All right, in our last class, in our last class, we think we stopped at the signs and symptoms of diabetes, type 2 diabetes, which we mentioned polyuria, polypharmacia, fatigue, and weakness of the body, and all those things. Now, today we are going to discuss on there is this particular one that is called pre-diabetes. In pre-diabetes, the sugar is above normal. Pre-diabetes, the sugar is above normal, but it is not diagnosed to be diabetes. Maybe when you check your blood sugar level and it is slightly abnormal, it's slightly abnormal, shows that diabetes is on its way. And there is this, in a situation where your sugar level is very high, in a situation where your sugar level is very high, what will you take to in order to reduce it? And before then, how do you detect? How do you know that your blood sugar is high? You know that your blood sugar is high apart from the symptoms through conducting a test, visiting a healthcare provider and or a laboratory a technician so that they can conduct a sugar test for you. And when they conduct the sugar test for you, that is when they will detect whether your sugar is high or your sugar is normal. So you do well to do a proper medical checkup so that it will be detected in time because early detection is the best. Now, what are the non-drugs approaches? What are the non-drugs approaches that you can use in order to do away from this a life-threatening condition, health condition? You eat more vegetables, eating of more vegetables, fruits, whole grains, beans and legumes. Beans and legumes, vegetable, fruit. These fruits are not the sugary ones or like the watermelon. If you are diabetic, you don't take watermelon, you don't take orange. If you are diabetic, you don't eat pawpaw because it increases your glucose level. It increases your glucose level. So you don't take those things in order to avoid complications because to be diabetic is another thing, but once you enter into diabetic coma, my dear, it is not easy. So many people have been entering into coma, and once they enter into coma, it's 50-50. Once they enter into coma, it has not been always easy to revive them. So as such, you need to like abstain yourself away from all those things that triggers your blood sugar level. Now, blood sugar level that we are talking about, can it be cured only with food? No, it cannot be cured only with food. And it's a life-threatening, it's a lifelong disease. But palliatively, you can manage it with legumes, like I just mentioned, with legumes, with protein-rich food, can manage it with some fruits. And also beans is one of the best food that is good for a diabetic patient. If you're a diabetic patient, you need to do away from gari, you need to do away from amala, all those things that are rich or that are highly, that their glycemic index is very high. It will help you to live long as a diabetic patient. Achieving and maintaining a healthy body weight. Don't eat bad fat. Don't eat food that contains bad cholesterol to help you to live long. Protein is the best thing. You can be eating egg once daily and it will help you to live long in a diabetic condition. Then you inspect your feet daily because at times it do causes swollen knees like pedal edema. When you check your blood glucose level regularly, if you check your blood glucose level regularly, it will be detected and the range will also be shown so that you know what to be done. Always visit a medical provider, a medical personnel. Always visit medical personnel for a proper medical checkup. What are the complications of this diabetes? Diabetes has its own complications. What are the complications? Follow, subscribe to my channel so that we can discuss it again and again. Thank you.